Hello, my name is Dr. Mary Trumpi, and I have a sports medicine clinic here in Santa Monica. I want to talk to everybody about what's happened in the last 3-4 months about everyone's quarantined, they're staying home. Luckily, I've been able to stay open for business as an essential business, and as people are kind of getting back into their regular routine, I've been noticing a lot of problems and injuries that are coming back from the quarantine and the stay-home order. With everybody sitting home for 4 months, there's been a lot of, everyone's sedentary. There's no movement in the body. They are having bad posture, different bad workstations. Another thing that's causing difficulties and injuries are everyone's trying new exercises. So first of all, everyone's sitting at home, whether we're active or not. Even if you're going into the office, most people are sitting at home. They've got bad posture. They are, we're sitting on the sofa with our laptop. Sometimes we're laying down with our laptop. Sometimes we're at the coffee table with your laptop. Sometimes people are standing at the kitchen counter, bending over with a laptop. Or if you're not working, you're on your phone. You're on your side, your shoulders start hurting. So with the quarantine, what I've noticed is people are coming in with new injuries that they never had before. Another factor that people have added in that everybody may notice this is everyone's trying new exercises. So they're like, oh, I can't go to the gym, I can't do my classes. I'm going to pick up running. They're going to pick up hiking. They may start watching videos, doing home yoga, and that's causing a lot of injuries. What happens with, let's first talk about posture, okay? What I've noticed a lot is we've had a lot of low back injuries, and people may be even sitting at home right now saying, ever since I've been home for 4 months, my back hurts. And let me show you a little bit about the spine and why your back may be hurting. So let's say you're sitting on the sofa, you're kicking it like this, and you're like, oh, my back is stiff, right? Or you're in bed, you're propped up watching Netflix, clicking, your back gets stiff, okay? Let me show you why this is happening. So first I'm gonna focus more on the low back because I've noticed that's been increasingly prominent in all my patients coming back in. Well, I think when people are actually at the office, at the desk, their neck is more stiff because they're over the computer. So here's your spine, okay? Head looking that way. Our head weighs a lot, by the way. Here's your skull looking that way. Optimally, you'd want to have a little curve in your neck that goes this way, mid-back, and low back. That's a natural curve. Inside of the spine is made of bones and discs, okay? Bone, disc, through the top to the bottom. The structure, the disc is the structure in the spine that keeps the bones off these, which are the nerves, okay? The nerves come out of the spine everywhere. For example, the low back, these 3 levels, these 3 nerves come down right to the middle of the glutes, go all the way down your leg, and that's the sciatic nerve, okay? Up in your neck, out of the middle of the neck, these 3 things on the model they're cut, right? They go all the way down the arms. So, deviating with chiropractic, right? So chiropractic, the manipulation of the spine, let's say you're always like this. It's the manipulation of the spine that takes the pressure off the nerves and everything functions better. But let's talk a little about low back. Optimally, you should have a little curve like this, but everyone's sitting at home, kicking it, bad posture, watching TV. The spine has a tendency to go this way. What happens with that is when the disc gets irritated, people say, oh, I have a slip disc, bulge disc, herniated disc. The terms are a little bit interchangeable. A disc doesn't really slip. So people have a misconception. They're like, hey, can you push my disc back in? Can you feel the disc? It's just slip, push it back in. But that's not what occurs. Part of it, for example, this red thing right here, that's a disc bulge. And that is just a part of the disc that has become swollen, irritated. And if it pinches this nerve here, you're going to have a pain pattern that goes down your back. So I've noticed an increase of people coming in with sciatic pain. Often, if you're sitting, going like this, the discs do have a tendency to move around a little bit, and they might migrate back a little bit, pinch these nerves, and you'll start having low back pain. Just this achiness. If the disc is injured, from repetitive sitting, sedentary, lack of exercise, it can sit right on this nerve. Depending on where your pain pattern is, just talking about the anatomy of the spine, that would let me know what level is irritated. This lowest part right here, this is called L5-S1. That is lumbar vertebrae number 5 and the sacrum. So the spine is labeled like that. So it's L1, L2 disc, L2, L3 disc. So L3, which is low back, its pain pattern, if it's irritated, will come more around here. L4, its pain pattern goes a little buttock, more leg, and L5S1, that pain pattern is right through the middle of the glute, down into the hamstring, and can go all the way down. Sometimes if you have a sciatic pain, sometimes you don't have much low back pain, and you can have quite a bit of back radiating pain into the leg. You may even have like an achy hip, an achy buttock, and they think it's a muscle. They're like, oh, I have a muscle here, just I roll it out, it doesn't fix it. That is often a compression from the low back that is compressing the nerve, and you're getting some leg pain. There's tests to differentiate if it's a muscle, but if you're sitting at home doing nothing and your leg starts hurting, it's most likely not a muscle strain. Similar issue, same theory, same anatomy in their neck, okay? There's not as much space in the neck. They're called cervical, thoracic, lumbar. We now know a little bit about the lumbar. We know L3, L4, L5, that's where the sciatic nerve comes out. We know the sciatic nerve goes all the way down to your leg. If it goes all the way into your foot and your foot is tingling, nummy, zingy pain, that's a lot of compression, okay? Going up to the neck, cervical. Okay, middle of the neck, C5, 6, 7. These nerves go all the way down the arm, okay? What happens with people, for example, if you're at the desk all the time, bad posture, you've now created a weird workstation, you're on your phone, what happens is the head has a tendency to come forward, okay? When that happens, the weight of the head, which can weigh 12, 14 pounds, suddenly it's held up by the muscles of your neck and your traps, no longer back in where the spine is holding up the neck. So, you're in good posture, big old head, it's on your spine, doesn't hurt. If this is happening, and this is happening, the muscles hold up the head. You'll start having achy traps. The people who always have the achiness here, even in mid-back by the shoulder blade, that is most often really related to, we call it a anterior head position, which means forward head, which means your head's coming forward, muscles holding up the head, bones aren't doing it. That too, let's say, just like the sciatic nerve goes down your leg, if it's pinched by a disc that's bulged, slipped, herniated, which basically means quite swollen, up in the neck, you'll have radiating pain into the arm, okay? Everything that runs the arms comes out of your neck, okay? And it doesn't come out of the upper back like some people think. So if you get a crick in your neck, or let's say the disc in the neck is pinched, again, it'll have a certain pain pattern. For example, C7, which is a little lower, it kind of goes tricep down here to the pinky. C4, C5, more this pattern. So there's ways to differentiate that as well. But just knowing the pain pattern, where you have pain in the arms, kind of gives me an idea like, oh, if you ache here, it's often middle of neck C5. We're going to do a lot of therapy on that. That's a pretty much good little version of the anatomy of the spine. We know it's cervical, we know it's thoracic and lumbar. We know the arms come out of the neck, the nerves that go into the leg come out of the low back. All of these other nerves run the whole entire body. So everything from the nervous system comes out of the spine. For example, mid-back, it feeds digestion, up in here, respiration, cardio, anything that like the organs are run out of the nerves in here. So if you are sitting like this all the time, it can put some pressure on the nerves that actually go to digestion. And you may find if you're really more sedentary now, there's less movement, you might have more stomach aches. You may have not very good digestion. You may feel a little bloaty and weird. That has sometimes, not always, but often has to do with if you're sitting in here all the time, these nerves are getting compressed. Let's say good day, 100% nerve flow. 2 hours sitting here, maybe 80% nerve flow. You're going to still function. You may not have pain, but just know that everything in our body that works comes out of the spine. That's why you got to get adjusted chiropractically by a good chiropractor. That would be me. And, or, any good chiro. Just keep yourself in the line. Going back to the sedentary lifestyle that we've now had for 4 months, and we're trying to get back into movement, okay? The next thing we've talked about, we've got some posture issues going on here. Now we know about that. Another thing I've noticed is there'll be a quiz, you guys, so you better study up. Another thing that I've noticed with my patients and people I've talked to is we've gone from a real sedentary lifestyle to like, oh, I'm going to pick up a new exercise. I'm going to start running. I'm going to start hiking, or I'm going to do a video, but the body's not ready for it. Even for pretty fit people, even people who still exercise, if they have gone from a sitting position like this, let's say, you stayed at home, you really haven't gone out, what happens with muscles is they can have a change in their length. So every muscle has a perfect length, okay? They can either be too much, loose, or too tight. Either way, it's not normal. So perfect position. For example, if I sit like this, what happens is my hamstrings are in a shortened position all the time. My quadriceps are kind of like a little stretched out, but this hip flexor muscle right here, this tendon, it's also in a shortened position. So you have shortened hamstrings, hip flexor, shortened tendon. The lats are really big muscles, and they attach all the way down to the spine down in here. So if you're not doing anything in the last 4 months where you really raise your hands above your head, which we don't unless we're reaching for some snacks on the top shelf, right? The lats will also get tight. So they attach deep in here, deep in the back. Let's say I'm going to start running. I get up, put on my shoes, I run out the door. What's going to happen is this guy's been shortened for months, right? And this happens over lifetime too, not just in quarantine and stay-home order, but right now I feel it very prominent. You stand up, this guy's shortened, right? It's not used to full this guy's shortened. You go to suddenly start running, right? And now the hamstring is being stretched. This hip flexor, these movements is being stretched out, and it's going to, or may cause pain or problems elsewhere. Often because, and then you're running, right? And the lats move when you're running, but they're also attached to low back. Hamstrings attach here. Going from a sedentary position and a sedentary lifestyle, moving into a new exercise that you're not used to as a human, that's when injury occurs. So I can talk about some things on what we do to address that, but just be aware that you wouldn't want to go from 2-3 months, 2-3 weeks sitting around to going to the beach and playing volleyball, especially even if you're super athletic and you can do all these things. If you just suddenly get up, I'm going to go play volleyball, you start slamming it, it's going to pull. It's not going to go into a rotation of the shoulder like it will. It'll probably pull something else. And you're like, why does my back hurt? I just went and played volleyball, now I can't move. Oh, I went running and now my back hurts, or my hip flexor's really tight. It's because the muscles often are out of balance. They've gone into a tighter constricted position. They can get back to normal, but that is a cause of some injuries I've seen. Another thing that I have seen is you're starting to hike, you're starting to do things. Everyone's trying to walk now or ride a bike, because that's all we have choices of, unless we have our special gyms. Let's say you just go running and now your knees hurt. Let's say it's not low back. You have to think about, if you're not a runner, you got to make sure you have good shoes. You can't, I love my shoes, but these are too soft, right? Even if you're athletic, for my opinion, especially if you've been quite sedentary, if you're going to pick up running, you need a shoe that gives you some arch support. Because let's say my normal stance is like this, but when we stand up, all of our feet have a tendency to turn in. That's called pronation, okay? And some people go from a sitting position like this, and they stand up and their feet really do this. But what you need to see is, if this is happening, see my knees go in as well? You won't look like this, but if you're running and your foot pronates, that means the arch collapses, the knee follows it. And you're running and your gait pattern is going to be like this. You're not going to really run like that. But even if it's just a few millimeters, the quads go through here, the tendons go through here, the kneecaps and the knees won't track properly. Also, if you have a tendency to pronate, all of that goes right into the back as well. I've had people that just went for a hike with the wrong shoes, and their knees went from fine to inflamed in a day, and in 2-3 weeks they still can't walk, they can't go up the stairs. Like, what happened? No one else's knees hurt. Or you do a hike, you do a run, your back is aching. You're like, why does my back ache? There's a couple things to look at. I always say, If you're hiking, running, walking, and your back starts to hurt, think about your shoes, think about support in your feet. If your knees start to ache, I always start at the bottom. Wear some good shoes. Of course, there's flexibility and stretching and things we should talk about, but the return to exercise or new exercise when we're not prepared on a biomechanical level, it's going to cause some injuries. So I've noticed with a stay-home order, a lot of back pain, sciatic pain, some neck pain. I actually don't see it as much as I do when people are at their desk. Feet and knee pain. So what we do about that, okay? Some of the things I suggest to people is every single day we have to start putting movement in every joint of our body. I've talked about this in the past that they say if you don't use it, you lose it, and that's truly a true statement. A lot of research has shown as we age, the thing that keeps us the most healthy and the most vibrant and the less pain is flexibility and range of motion. Of course, strength, as you're getting 50, 60, 70, you need some strength, but if you can keep your body mobile, your joints mobile, the tendons and ligaments will be loosened up, then the chance of injury is less. So everybody, whether you're 20 or 80, I suggest every day you start putting some movement in your body, okay? And that can be as simple as, you start at the bottom. You just move your ankles like 4 times, okay? And it seems simple, but if you've not done that for 4 months, you can't go run because something's gonna hurt, right? Then just even step up 4 times, okay? And people often, our backs are stiff, so I want you to put some movement in here like this, but it wouldn't be a real forceful thing because that can injure you. So it's just swing a little bit, put some movement in there. You also just want to roll your wrists both directions, fully bend and extend your arms, because unless we're weight trainers or we're doing something, we don't really extend our arms all the way. And you'll never get stuck like this, but you wouldn't want to be like this for 3-4 months on the phone. All of a sudden you're going to go do some bicep curls, something's going to hurt. Again, foot, knee, little swing, wrist, Then I suggest, some arm circles, 2 each direction, okay? Arm circles, 2 each direction, okay? I like a side bend because this stretches the lats, because we don't do this in a real life ever, like unless you're doing a class, but that will help stretch out the lats that have gotten shortened from sitting too much, okay? For a neck stretch, I suggest doing my neck stretches seated in the beginning so you don't recruit any other areas or pinch any nerves. Key when you're trying to do stretches and movement is you got to stand up straight. I forgot to mention, when you're going to start to do your movements, you can't be like this because you won't be able to move your shoulders. You've got to raise your chest, make sure everything's in alignment, and then do the movements. A tip I tell people is, I'm like, stand up straight. Everybody does this, right? Standing up straight is more about taking your shoulder blades and putting them in the back down, almost like into your shoulder blades. And you don't involve this. For example, bad posture, good posture. Look from the side, bad posture. And now I'm not doing anything with my shoulders. I'm lifting my chest, shoulder blades going down, and see how it automatically brings my head up? That's how you get into good posture. This is not involved, okay? Because then this creaks your neck. Talking about neck stretches, and the reason I like to do them in a seated position is because you're not going to recruit anything else. You kind of want to get this guy going. So you start chest upright, like we just talked about, shoulder blades down, and you can take one hand on your head and gently stretch. 1, 2, 3, 4, 5. Come back out. When our neck is at its most vulnerable point is when it's really stretched out. Like you wouldn't want to go from a stretched position to like whipping it back because that's going to pinch a nerve, might hurt. Gentle. 1, 2, 3, 4, 5. Come back out. Gentle pull. And you're not pulling. You're just kind of resting. At the same time, you can reach toward the floor. 1, 2, 3, 4, 5. It stretches all of the muscles that go into the traps. There's all these other little muscles in the neck that are involved. Same thing, this side. Hand here, reach down, 1, 2, 3, 4, 5. Again, it's not a forceful stretch like, oh, let me stretch it out. It's like, let's lengthen it slowly. Come out, lengthen it slowly. We do not need to stretch our neck down very often because we're always down, okay? There's not really a way to stretch back because if you bend back, some people's neck get a little pinchy in there. With extension, I don't even really do too much. You can just go back a little bit, but don't hold it. You could nod maybe 4 times and then stop. Most important is the side, and the next one is a diagonal to where you're stretching your head toward that knee. Same thing. Same side hand, you wouldn't want to do that. It would be weird. So here, go down. 1, 2, 3, 4, 5. Again, come out slow, back down. 1, 2, 3, 4, 5. Other side. So you're going to go bend, bend, diagonal, diagonal, nod, and nod. See, if I was standing, you might involve something else. So I suggest neck stretches seated. Doesn't matter if you have a back on your chair or not. Good posture. Movement, standing up, all ranges of motion, okay?